OK, so your views then, you support the strikes, I presume. What's the reasoning behind that? What are your thoughts on it?
Hi, so I'm Alia, I'm a psychotherapist. Yeah, I mean, I wouldn't necessarily say anybody who works in the NHS, particularly nurses, want to go on strike. I think, and I'm speaking directly maybe to Julia here, we've been protesting for, years and years and years. We've been upping those protests over the pandemic, even when it had to be done in kind of more creative ways because of the lockdown. But unfortunately, we're not being listened to. And you're right, there's not nearly 7 million people on wait lists, but we've also got 165,000 vacancies. We're struggling to recruit staff, we're struggling to retain staff. So it just means that people are working in dire conditions, horrific conditions, where they're burning out, they're leaving the workforce in swathes. I agree with Julia that it's a terrible time to have to strike. However, if we wait any longer, there'll be no NHS and there'll be no staff in the NHS. The situation will only get far worse. I think to the point about listening to the public and, the government's decision to reduce the uncosted, to bring it down from 45 to 43 billion uncosted tax cuts, that's because of the public's uproar against a small kind of part of their policy. But that does show that they do listen, and so it does show that they do listen to public uproar. It doesn't necessarily show that they that we're being listened to because we're being understood. It's because people are saying that they won't take things the way that they're being delivered. So that does mean that strikes can possibly be effective, and possibly we can get better conditions of work, which means that people will want to join the NHS, that people will want to stay in the NHS, and it also means that people will be able to put food on the table, pay for their rent, and come to work healthy and able and capable to save lives, which is what we want to do. And we can't really do that when we're having to use food banks, having to access benefits despite being in full-time work. So it's just not really sustainable. And as I said, nobody wants to strike. It's in healthcare, it's genuinely the last thing we want to do.